Good morning, afternoon, or evening, everyone. So, as it has been said, I'm going to talk about the impact of mycotoxin on immune system. So, I'm not going to introduce what mycotoxins are because it's not the first seminar, but I'm just going to give you an example of the multiple effects that mycotoxin can have, and I will take the example in pigs. So we know that there are different mycotoxins, and we know, for example, that aflatoxin B1 has its main effect on liver. It induces liver toxicity, but has also an impact on growth. As far as ochratoxin is concerned, it more targets the kidney. Deoxynivalenol and T2 toxin are two trichotiken, and trichotiken are known to affect growth and feed intake, inducing anorexia. Fumonisin B1 is known, especially in pig, to target the lung, and zearalenone is known to target the reproductive tract. But as you see, all these mycotoxins have an effect on the immune system, especially aflatoxin, fumonisin, and trichotiken. In fact, when talking about the immune system, it can be divided into two kinds of response. There is first the innate immune response. This response is rapid, but not specific. And this innate immune response involves immune and non-immune cells, such as epithelial cell, endothelial cell, and immune cells such as macrophage, neutrophils, or dendritic cell. Conversely, the acquired immune response is very specific, and it is the type of immune response that you have during vaccination, but it's slow. And the acquired immune response only involves immune cell, especially lymphocyte. So it's not possible during 40 minutes to give you an overview of the effect of all the mycotoxin on all the type of immune response. So I'm just going to give you some example. Here is the first example that the mycotoxin aflatoxin B1 has an effect on macrophages. And as you see on this slide, on this part of the slide, you see that it reduces the effect on production of nitrogen oxide and about oxygen reactive species in a dose-dependent manner. And this leads to an increased cell death of macrophage in the type of apoptosis. So we have an effect here showing that aflatoxin B1 decreases the functionality and increases the mortality within some immune cell. In our lab, we did quite a lot of experiments trying to investigate the effect of mycotoxin on the immune response in pigs. The experimental protocol that we used was most of the time the same. The animals were exposed to mycotoxin for 4 weeks. And during these 4 weeks, they also were vaccinated with model vaccine, which is ovalbumin. And during these 4 weeks, we look at the immune response, both the humoral immune response, which is mainly antibody, and the cell-mediated immune response, which is mainly lymphocyte proliferation. And we look at this immune response both toward the antigen we use, the vaccine that we're using, but also the total immune response, so total antibody or total lymphocyte proliferation. And here are some results that we get. Here is this experiment where we use T2 toxin and the animal receive either control food or food contaminated with 0.5, 1.3, or 2.1 microgram per kilogram T2 toxin during the 4 weeks. And they were vaccinated with this model vaccine ovalbumin, and we look at the antibody response. When we look at the total antibody response, you clearly see that there were absolutely no effect. But when we look at the specific antibody response, meaning the antibody response toward the vaccine, you clearly see that the group of animals receiving the highest level of mycotoxin had a reduced antibody production compared to the control animal or the animal receiving the lowest dose of mycotoxin. We did exactly the same response with the same experiment with another mycotoxin. Here it's aflatoxin B1, and the animal received either control feed or feed contaminated with 0.4, 0.9, or 1.8 microgram per kilogram aflatoxin per kilogram feed. And we look at lymphocyte proliferation. And when we stimulate all the lymphocytes, we didn't have any effect. But when we stimulate the lymphocyte with the antigen that we use in the vaccine, you clearly see, especially after 2 weeks, that the control animal, the animal receiving the control feed, responds really well. By contrast, the animal receiving the feed contaminated didn't respond that well. So it indicates that low dose of mycotoxin decrease the antigen-specific immune response without altering the global immune response. So really, to see an effect of mycotoxin on the immune system, we need to stimulate the immune system. So, as I show you here, we look at the humoral and cellular immune response for 2 mycotoxin, T2 toxin, or aflatoxin B1. And I show you that for T2 toxin, we had a decreased immune response, especially in terms of antibody production, and with aflatoxin, we had a decreased lymphocyte proliferation. But when we look at the antibody production for aflatoxin B1, there was even the specific antibody production, there was absolutely no effect. And when we look at the specific cellular immune response for T2 toxin, we didn't have any effect. So it really indicates that each mycotoxin acts differently on the immune response. T2 toxin affects the humoral immune response, whereas aflatoxin affects the cellular immune response. And so, if we need to characterize the immune effect of mycotoxin, we need to investigate different parameters of the immune response. So, to conclude on this first part, we've shown that each mycotoxin acts differently on the immune response. I show you that T2 toxin alters the antibody-specific production, but doesn't alter the cellular immune response, lymphocyte proliferation, and this is the opposite effect for aflatoxin B1. So we really need to investigate the effect of mycotoxin on several parameters to be able to see what are the effects of mycotoxin on the immune response. Another conclusion of this experiment, it shows that low dose of mycotoxin decreases the specific immune response without altering the global immune response. So we really need to stimulate the immune response to investigate the immunosuppressive effect of mycotoxin. What is even more important than knowing exactly what mycotoxin are doing on the immune response is to study the consequence of the modification of the immunity on pig health. And basically, the fact that mycotoxin alters the immune response has 2 consequences. The first is an increased susceptibility to infection, and the second is a decreased vaccine efficacy. And I'm going to give you some examples on these 2 parameters. So here is an experiment that we did also in our lab with piglets that were exposed to fumonisin B1, and they were after that infected with an oral infection with a pathogenic E. coli. And what you can see that at the end of the experiment, when we look at the number of bacteria in the intestine, there was much more bacteria in animals that were exposed to the mycotoxin. This is a log scale, so the increase was at least 10-fold to 100-fold more bacteria in the intestine of the animal that get the mycotoxin. And here in these photos, you can see here the small dots are the bacteria that were stained, and you can clearly see the bacteria that are attached to the intestine. So this really shows you that the fact that mycotoxin can increase susceptibility to infection. This is another example, still with fumonisin B1, but here it's in chicken and still E. coli infection. Here it's 21-day-old chicks that were injected with E. coli, and after the bacterial injection, they were killed, and the number of bacteria were determined in different organs, spleen, liver, or lung. And you clearly see that there was 4.9 in log 10, there was 4.9 bacteria in the control animal receiving no fumonisin, but when they received fumonisin, it was more than one log higher, meaning that it was more than 10-fold higher. And we see that in the spleen. There was also an increase, but it was smaller in the liver, and there was no effect in the lung. This is just 2 examples, but if we go through literature, there is quite a lot of examples that has been observed. And here is just a survey of a literature survey of experiments that have been done in chicken. So with DON and acetyl form of DON, zearalenone and fumonisin, and with Emeria maxima, there was a decrease of CD4 and CD8 T cell in the mucosa. With also DON acetylated form, and then there was an effect after also infection with Emeria. There was an effect with E. coli, Salmonella, Clostridia, Salmonella, Clostridia, Salmonella gallinarum, or also E. coli. So there is a lot of evidence that really the fact that mycotoxin alter the immune system will increase susceptibility to infection. Here it's a review on poultry, but I can have the same slide on pigs, for example. This is an experiment that I like to show because here it's not an experimental infection. In this experiment, what happened is that it was in a farm. They were given ochratoxin in the feed at 1 ppm or 3 ppm. And basically what happened is in this farm, in animals that received the low dose of ochratoxin, 2 out of the 6 animals developed salmonella infection. And in the group of animals that received the high dose of mycotoxin, they all developed a salmonella infection. So here it really indicates that the sanitary status of the farm was not very good because there was salmonella around, but basically the animal receiving the control feed didn't develop an infection. Their immune system was strong enough that they can fight against the infection. But when they receive a mycotoxin, they could not fight, and then they develop an infection. And what is even very interesting in this experiment, then they did the experiment again, and they say, okay, we have a salmonellosis problem in our farm, so we are going to vaccinate against salmonella. And they repeat the experiment the same way. Here they use only the animal feed with control feed or with high level of ochratoxin. They didn't have to wait 13 days, they have to wait much longer. But after 47 days, in fact, out of the animal receiving the high level of mycotoxin in the feed, 1 developed Brachyspira infection and 1 Campylobacter infection. So basically, it really indicates that if you have mycotoxin in your feed and you don't have a good health sanitary status, whatever the pathogen that is around, the animal will catch the pathogen and will be infected by this pathogen. So this is the first set of examples that I show you, indicating that the fact that mycotoxin decrease the immune system will increase susceptibility to infection. But there is also the immune system is also used during vaccination. And it has also been demonstrated that the fact that mycotoxin decrease the immunity will have an effect and will decrease vaccine efficacy. Here is some example. So here it's an experiment with aflatoxin on viral infection. So basically there was more than 600 chicks, 2 months of age, that received feed contaminated with aflatoxin, and they were vaccinated and then challenged. They were vaccinated to different infection and then challenged with the pathogen. And basically, you can see that in the first set, they were challenged with Newcastle disease. There was an increased antibody titer and leading to an increased mortality in the animal that received aflatoxin. Exactly the same result with infectious bronchitis. There was a decreased antibody titer and increased mortality after challenge. By contrast, with infectious bursal disease, there was a decreased antibody titer, but there was no effect on mortality. This is another experiment that we did in our lab with the vaccination, and it was a mycoplasma vaccination against mycoplasma. And when we look at the total antibody response, there was absolutely no effect. But when we look at the specific antibody response, you clearly see that at the end of the experiment, the animal that received the feed contaminated with fumonisin, get a lower antibody response than animal receiving the control feed. In this case, because we are scientists, we try to look at the mechanism involved, and we see that it was because of cytokine, because there was an alteration of the Th1, Th2 balance that is really important for antibody production. And in addition, we had a decreased lymphocyte proliferation that lead to a decreased antibody production and lead to a decreased vaccine efficacy. I think that's quite important because breakdown in vaccinal immunity induced by mycotoxin may lead to occurrence in disease even in properly vaccinated pigs. And the problem also is when you get the disease, you know that you have vaccinated your animal, but most of the time you don't remember what type of feed you were giving to your animals months or 2 months earlier when you were vaccinated your animals. So if we try to conclude on this part, we can see that mycotoxin can alter several aspects of the immune response. I show you that T2 toxin alter the production of antibody, whereas aflatoxin B1 alter the lymphocyte proliferation. And this really has some consequence in terms of pig health, or even in animal health in general. It increased susceptibility to infection. I didn't show you, but there have been experiments also showing that it reactivates chronic infection. I show you that it decreases vaccine efficacy, and there are also experiments that show that ingestion of mycotoxin may also decrease drug efficacy. However, in most of the case, the underlying mechanism still need to be elucidated. I show you for fumonisin B1, we did some experiment, and now we know what is the mechanism. It is due to cytokine production and lymphocyte proliferation, but for some other case, it's really not known. For example, the case of ochratoxin that I show you that decrease, that ingestion of ochratoxin increased susceptibility to several infections. We don't know exactly the mechanism. So I'm almost finished this part of my talk, but before finishing, I wanted also to tackle a new problem that is today on mycotoxin. And this is the problem of mycotoxin co-contamination. Co-contamination is a reality. It's a reality for several reasons. The first reason is that fungi produce several mycotoxins simultaneously. Because also feed may be contaminated by several fungi at the same time, and because the animal diet is composed of multiple raw material. For all these reasons, we have a co-contamination. And this is, for example, a survey that has been done in almost 10 years ago on more than 7,000 samples. And in this survey, it indicates that about 20% get low level of mycotoxin below the limit of detection. That 33% in this sample there was one mycotoxin, but in 48%, they detect more than one mycotoxin. And so contamination by several mycotoxins is the rule, not the exception. And most studies have investigated the effect of mycotoxin when present separately. And we really need now to investigate the effect of mycotoxin co-contamination. What are the effects of this co-contamination? So the experimental design to study mycotoxin mixture, you need to have a two-step approach. First, you need to do a dose effect of each mycotoxin when used individually. And this is quite important. This is just two examples, two dose response examples. In the one on the top, you see that when you multiply the level of a contaminant by 2, from 2 to 4, the response is only increased by 13%. But in other example, in the bottom, when you go from 2 to 4, you increase the response by 11-fold. So you really need to first have a dose response analysis. And then when you have this dose response analysis for each mycotoxin, you can compare the predicted effect of the combination with the single effect of the combination. And then you can determine if they have no interaction or if they have synergistically or antagonistically. And the big problem is that many studies addressing mycotoxin interaction are very difficult to interpret because there is no dose-response experiment. We did some experiment with mycotoxin mixture, especially on cell, on human cell or on porcine cell, and we see that in the vast majority of the case, we observe some synergy. It was with different trichotican done and 3-acetyl done and 15-acetyl done, 15 and 3-acetyl done and nivalenol done and fusarenol X, nivalenol and fusarenol X. And you see that at low concentration, in the vast majority of the case, the main type of interaction is observed is a synergy. So that really indicate that this synergy need to be taken into account. So now I go to my conclusion. So mycotoxin have multiple effects on animal, and among them, they are able to modulate the immune system. And the main consequence of this is in terms of susceptibility to infectious disease and in reduced vaccine efficacy. Something that I didn't show you also is that mycotoxin are able to alter the intestinal barrier function. Then the intestine is not a barrier anymore. And this has some consequence in terms, especially in terms of pathogen translocation across the intestine. What I show you is that despite of the frequent co-occurrence of different mycotoxins, little is known about the interaction between these toxins. And also, something that is new is that there's more and more new fungal metabolites that are identified, emergent mycotoxin, mask mycotoxin, and now we really need to address their toxicity. And with that, I finish my presentation and I thank you for your attention.
Okay, thank you. So please feel free to use the question area, the chat area, to type questions. We'll have, as I said, Dr. Olga Verkieva and Dr. Julia Dvorska to answer the questions. And if you have questions in Spanish and Portuguese, please type them as well, and we can translate them to the panel. So I will start reading some questions here. First one is, somebody asked about the concentration of aflatoxin in one of her studies. I think he's asking if it 0.4 parts per million of aflatoxin is a low dose. I don't know if there's a miscommunication there. Can you answer that, Olga?
Yeah, I was not sure myself because it looks like that's quite high if it's in ppm indeed. But in her speech, she was mentioning ppb. I was pointing attention to that fact, but it would be best to double check with her because it's possible that it was indeed 0.4 ppm. It's high dosage, but of course in her trials, which are challenged trials, she always refers to low or high dosage. But in field conditions, they might be really not considered the same, low and high. They could be considered in any case very high dosages. But
Okay.
we will record this question and we check it later.
Okay, thank you. Second question here is, should we also look at long-term effect of low doses seen in the field of single and multiple mycotoxins? I'll ask that to Dr. Julia.
Yes, long-term effect is very important, as Isabel showed today. If you remember that slide on the like reoccurring infection, or when they found in normal condition with ochratoxin in feed, they found in 4 weeks, they found, if I remember right, salmonella, but in 14 days, they found brachyspira, meaning that when we have long-term effect, we would expect even more chances to have some infection, like from the pathogens, if they are present on the farm, or if they are present again, if they are also present in the gut, and we have this barrier function decreased in the gut, so we would expect that all we have in the gut could get to the could cause some negative effects. So low dosage and long-term effect is very important. Yes, sure.
Okay, I will follow that question with another one that is very similar, but also mentioned about the synergistic effect of those mycotoxins. So do you think that a combination of doses below limit might be significant about when you have synergistic effect?
Synergistic effect is very important, right? And again, today it's only studied like in research conditions. We are not, when we talk about the field conditions, we never think about the synergism, and the maximum what we do, we can have additive effect, right? We can try to add some trichotetans, for example, DON plus 3-acetyl DON and nivalenol, for example. Maximum we can do to have the levels to analyze. But again, as Isabel mentioned, it's difficult to know and difficult to explain this for real conditions, and it should be studied well and should be studied more to understand. But yes, at least for trichotetans, she mentioned that synergy is in most of the cases it should be synergy synergistic effect, meaning that it's not like 1 + 1 is 2, it should be 4 or 5 or whatever. Yeah, so it's very important.
If I may also add from my observations that at least we have to consider additive effect, as Julia mentioned, but of course synergism is the main effect between most of mycotoxins, and some of them like deoxynivalenol and zearalenone are one of the most known synergists.
Okay, thank you. I will keep with you now, Olga. I have a question here. With mycotoxins seldom found singularly, what is the best standard program to control them that gives the best risk management? And what binder product or combo of molecules works best?
Of course, it depends on mycotoxin, because sometimes we deal with aflatoxin, and this is the easiest to bind. And the binding mode of action is the best against this mycotoxin because it's bound and then excreted from the body, because this is toxic mycotoxin, which is destroying liver mainly. And via liver and circulating through the blood, it also can affect immune system. But if, for instance, we bind deoxynivalenol, the target organ is gastrointestinal tract. And by increasing the level of deoxynivalenol in the target organ, probably it will be not the best mode of action against this mycotoxin. So I think we can't address just all mycotoxins as one issue. We have to have a multiple approach and think about the consequences of each mycotoxin. So I would say binders are standard solutions, cheap and available for aflatoxins and ergot alkaloids. And for other mycotoxins, I would think I would recommend to use other more complex products with different modes of actions.
Thank you. Next question would be, when we see the mycotoxins can reduce antibodies response of vaccines, if we increase vaccine concentration, could we improve the immune response? If not, could we admit that it's real necessary to control mycotoxins to protect immune response from vaccines? Julia, do you want to respond to that?
Yes, you remember Isabel showed us their own research using the OVA vaccine. And it shows that the antibody titer decreased, but total immune response is not changed. Meaning that in this case, only we have a negative effect only when we have challenge. And this is the same as we have the infections, recurring infections or infections due to sanitary status. Meaning that if we increase, I think that if we even increase the level of vaccination or vaccine concentration, the effect will be the same. Because in this case, the immune system will not work properly due to during the vaccination process, and when it should increase the level of antibody, it should be activated well, it will not work good. So it will not help, I believe. So we need to control mycotoxins, especially during vaccination. Not all other times it's also very important, but when we have the vaccination program and at least during the vaccination, mycotoxin control would be necessary, I believe.
Okay.
I also have some field observations that, of course, increasing the volume of vaccine will not help. Some people, they are trying to revaccinate animals, and even we have some customers met that were vaccinating with 3 times. So with 2 dead vaccines and 1 live vaccine, for instance, against I think Newcastle disease or avian flu. I don't remember. I'm not a vet. I'm sorry for that. But it did not work. It did not work because just the immune system could not respond neither to the number of vaccinations and no to type of vaccine. So this is just blocked. It's like, yeah, if someone is dying, if you give more pills to that person or to this animal, you can't really bring it back to life.
Okay, thank you. And I will follow that question with another one that is asking about the age. Is there any effect on age of the animal on the response to immune system and mycotoxins, or specific phases like breeders or young animals? And also another one at the same area here that asks about the difference between poultry and swine, if there's a difference between them on the response of the immune system for mycotoxins. Olga, if you want to answer that.
I will try to answer, but again, I give my excuses because I am not a vet, and I know that younger animals are really more susceptible to mycotoxins because they are less protected, especially in the gastrointestinal tract. The barrier works worse in small animals or younger animals than in the adult animals. But regarding the response to vaccine, I think it depends, of course, at which age is made, of course, and also what type of immunization animal already got. That if, for instance, you give it to young piglet who could not develop yet the immunity via colostrum of sow milk, of course, there will be probably more susceptible to mycotoxins than the piglet of a little bit older age, but already developed certain immune response. But again, I can't really answer this question good. Maybe if Yulia can add anything to this.
I agree with you, Olga. Exactly. In young animals, immune system is not developed well, and also gut, as we know that 80% of immunity is happened in the gut, and gut is not developed, and immunity is not developing. So that's why young animals are especially sensitive. If we're speaking about the, for example, piglets, yes, they are especially sensitive, and regarding the difference between poultry and pigs in the immune response on mycotoxins, well, I don't think so that there is some difference, some really pronounced difference in effect of mycotoxins on immune system in different species. But as Isabel showed today, there is some difference in response in different mycotoxins, like the one they were tested like T2 and DON and flumonidine, and they also different. They are acting or working on the different parts of the immune system. But results, you see, the results are the same. So there should not be much difference in this. I think that's it. Age and species, right, Guillermo?
Yep. Thank you. There's another question here on concentration of mycotoxins. I think we touched a little bit about it, but it would be good to cover it again. Julia, if you can. It's asking, I wonder what would happen with more realistic contamination doses of mycotoxins. Some are around 20 to 30 parts per billion of aflatoxins, half to 1 parts per million of DON, and 2 to 3 parts per million of fumonisin. What would be the realistic effect on the field on that?
Yes, it's good question, because on the real situation we don't have such a high concentration as usually used by researcher. When they have research, they need to have some pronounced effect, so we always use these high levels. But I remember one of the papers on DON in broilers and vaccination against Newcastle disease, and the level of DON was 500 ppb. So it's like not high at all. It's like 10 times below the regulation levels, recommendation levels, right? And it was negative effect on the antibody titers. And there are some papers in literature with low levels, so we can find it also. And again, it is effect, negative effect on the antibody titers. Always in any papers we show on this topic always shows the negative effect. And these levels you mentioned is not that low, so we will expect negative effect, and we have scientific evidence on that.
If I may add also my experience, that for sure that these levels mentioned to 20 to 30 ppb of aflatoxins, they are already quite toxic. And for vaccination, definitely there will be effect, probably not on performance, but on the health. Deoxynivalenol is also one of the less toxic mycotoxins in terms of performance, but one of the most toxic mycotoxins in terms of the health and immunity. So the levels mentioned like 0.5 to 1 ppm, or if I convert to ppbs, 500 to 1000 ppb, definitely will affect the immune response. However, I would doubt about the fumonisin level mentioned, 2 to 3 ppm. So it's quite low level. Fumonisins are known to be important mycotoxins, but the levels must be significantly high. And 2 to 3 ppm, I have doubts that you will see the response or negative response on vaccination.
Okay, makes sense. Olga, I will keep with you now. There's another question on control methods for mycotoxins. The question is, what's the best metric to compare different competitor products in terms of mycotoxin control?
A very relevant question, and this is really a frequent question, and there is no ideal answer to that, because in vivo trial is the best setup or the best comparison between two products. So you put your animals in your conditions, but feeding with the same feed, but with two different products, and you can see the effect because your conditions can be quite specific. Just using, as now is fashionable, to use just in vitro data for comparison, I think it will mislead you to the conclusions. If you want aflatoxin control, probably you can rely on in vitro data. But if you want to compare products against zearalenone or against especially deoxynivalenol and fumonisins, the in vitro binding data can really misguide you and even leading to the wrong conclusion, because sometimes binding these mycotoxins like deoxynivalenol and fumonisin can increase the problem, as I mentioned already before, because you will bring some mycotoxins to the target organ in higher concentrations. Like deoxynivalenol will affect the gastrointestinal wall, and then with all bad consequences. So best is in vitro, in vivo data. If you can develop yourself, this is the best. And if not, then you have to request this data from the producers of the additive. But please ask for right animal category, which is interesting for you, and also mycotoxin or mycotoxin combination, which is interesting for you.
Okay, thank you. Question for Julia. What's the mode of action of DON on immunity? In which organ this take place?
Well, it's not known actually what is the mechanism of action of DON and which organ, meaning that it's decreasing lymphocyte proliferation. And well, the target organ for the DON is gut anyway, and gut is the like 80% of immune cells. So it's all happening in the gut, and it's decreasing the lymphocyte proliferation, and maybe again like changing this balance of cytokines which are necessary for good antibody production, and that could all be like mechanism of action. But I also believe in one of mechanisms of action on immune system is a decrease of antioxidant status. Most of mycotoxins can induce oxidative stress, and oxidative stress can decrease the ability of immune system to work properly. Like one of the theories that all the immune cells has the receptors and they are really susceptible to lipid peroxidation. And these receptors are necessary for communication of all the cells, like lymphocytes and macrophages and all cells. They need to communicate and to like give the signals to produce cytokines or produce antibodies and so on. And when we have oxidative stress, like free radicals, they can damage these surfaces of cells, receptors, so they cannot communicate effective anymore, and meaning that in this case we are going to have decreased all immune response. That's another of theories. There are a lot of theories. It's all the theories and with scientific evidence actually. Yeah. So
And if I may add also, the apoptosis of gastrointestinal cells can be also a contributor and lower immune response, because gastrointestinal cells, there are a lot of immune cells, and if they die, then they cannot anymore produce.
Yeah, exactly. And lipid peroxidation will cause apoptosis. So again, right?
Okay. I think we have no more questions. Oh, there's one more here pretty quick. Do we know about factors that can increase mycotoxins effects, such as gut injuries, water pH, previous liver, kidney, etc.?
I will answer this question. I think all stress factors can increase the influence or severity of another stress factor. So if mycotoxins are present, or if there is a certain stress factor that animal is ill or water is not really of the good quality, that the effect of mycotoxins will be more pronounced. But how much, what kind of synergism or additive effect it would be, it's not known. It's really your specific situation, and the best, of course, when you are choosing for the product, you test it in your conditions.
Yeah, right. I can add that yes, mycotoxins are also stress, stress conditions for animals. And if we have some other stresses, like anything, it could be heat stress or maybe some negative, something in the feed or oxidized fat or anything that can again increase the severity of mycotoxins. Yeah.
I think was it the work of Isabelle Oswald or someone else recently, that combination of mycotoxins with heavy metals, but even not at high levels, at permitted levels in feed, can be really very crucial. So that the severity of mycotoxicosis, but also poisoning with lead or arsenic, I don't remember exactly which heavy metals it was, that can be enhanced and can be synergized.
Yeah, so all the stress factors together increasing the level of negative effect of mycotoxins, right? That's right.
Okay. Okay. Last question here. We have one more until we finish. It's rightfully mentioned by Olga. DON is almost impossible to bind with typical clay or yeast-based products. What is your suggestion for efficient products?
Olga, would you like to continue your talk, and then I will add?
Okay, I will do this. In fact, it's also depending a lot on the species. If we look at the nature, that for instance, pigs, they have a natural defense against deoxynivalenol. They have a very high bioavailability, so about 80% of deoxynivalenol is absorbed through the gastrointestinal wall in stomach already, and in the upper parts of the small intestine. It goes directly to the liver, and liver metabolized deoxynivalenol to non-toxic metabolite, DON3-glucuronide, and it's excreted from the pig body with the urine. So in fact, in wild pigs, DON is not an issue because pig is able to decontaminate it. But in modern agriculture, it's not possible because pigs are processing a lot of feed. And without help of the product, they cannot really utilize their natural mechanisms to control DON or to level DON in the body. So the additives that can help liver to work better. So the animals with damaged liver will not be protected by nature from DON better, or it will be protected worse. Also to help to improve the gastrointestinal integrity, because if deoxynivalenol is going to the gastrointestinal tract or stays there, that it will affect tight junctions and the gastrointestinal integrity in general. So if you can use some alternative additives to help gastrointestinal tract to repair from the possible DON damages, it's also good. So some antioxidants with in vivo effects can help because one of the mechanisms of deoxynivalenol on the cellular level is oxidation. So it's a combination. If we speak about poultry, it's a little bit different because poultry has quite a low bioavailability of deoxynivalenol. However, liver also can destroy DON and excrete a non-toxic metabolite. But in poultry, the higher level of DON is passing through the gastrointestinal tract, and higher levels of DON are found in distal parts of gastrointestinal tract, and then can cause necrotic enteritis, for instance, being a precursor. So in that case, of course, the focus is on the supporting the gastrointestinal health with whatever means. Also, using maybe some enzymes or bacteria can be potentially, but you make sure that they are working in the right part of the intestine or gastrointestinal tract, because what is now commercially available is working at pH at 6, and at pH 6, all damage is already done. So we need to catch DON earlier or try to repair the consequences also earlier at pH 3, 4, or 5. So there is no simple question on DON protection.
Yeah. Okay.
Yes.
Thank you. Julia, want to conclude?
Yes, I just wanted to add also, and it's if you remember from our first episode by Vito, he said that it's not possible to bind DON at the moment. There is no effective binders for DON, meaning that yes, in most of the cases, for example, for as mentioned by Olga, for pigs, we need to help animals to recover, to help them to deactivate, like in liver, to support gut again. And since we don't have anything to bind, and if we bind it and take it to the gut, like in broilers, it's not good.
Yeah, we don't know if the bound mycotoxin is inactive. So we suggest, or it's like logic to suggest that bound mycotoxins are inactive. But imagine that they are quite large molecules, and even if they are bound to the clay or whatever adsorbent, still they can be active because we don't know which part of molecule is bound.
So it was taken to gut, to the low gut, for example, in broilers, and still active. So in this case, it would be better to let liver to inactivate it.
Okay.
Yeah.
Thank you, ladies. Appreciate it. So yeah, we are about 1 hour from the start. We are about time to finish. I would like one more time to thank you, everybody, for joining us for this MycoInfo series. I think it's been very informative session. Next one will be in April 13th, same time, 10 a.m. Eastern Daylight Daylight Time, and will be with Dr. Hildy van Meijherger with mycotoxins effect on reproductive, pulmonary, and digestive on respiratory systems, and how we help. So looking forward to that next session. and to your participation. And I will let Mateus now just to say a couple words before we finish. Thank you very much, and I'll see you next time.
Obrigado, Guilherme. Somente gostaria de agradecer a todos os amigos. Espero poder encontrar com vocês novamente daqui a 3 semanas. Um abraço a todos. Obrigado, Olga, Júlia. Tchau, tchau.
Thank you very much.
Thank you.
See you next
Bye-bye.
time. Bye.